Causes of increased spread of HIV/AIDS in persons living with disabilities. Let's look at some of the causes of the increased spread of HIV/AIDS in persons living with disabilities. Statistically, more people are living with HIV today. But it's important to note that the global prevalence of HIV infection averagely remains at the same level. Persons living with disabilities are among the groups most affected by HIV/AIDS. 1. Lack of access to sexual health education. The major cause of the increased spread of HIV/AIDS in persons living with disabilities is that they lack access to sexual health education. There is a general misconception that disabled people do not engage in sexual activities, therefore they are in most cases left out of sexual education programs. Because of that, they are not educated about the risks of unprotected sex, putting them at a higher risk of contracting HIV/AIDS. 2. Limited access to healthcare services. Persons living with disabilities face numerous challenges in accessing healthcare services, including HIV/AIDS testing and treatment. Healthcare facilities are inaccessible for them, and most can't afford medical care. All these keep them away from vital health services. 3. Stigma and discrimination. Persons living with disabilities also face significant stigma and discrimination, which can increase their risk of HIV/AIDS infection. Many people still hold misconceptions about disability and HIV/AIDS and persons living with both, thus leading to negative attitudes towards people with disabilities. This makes it hard for disabled people to access healthcare services. 4. Limited access to prevention and treatment programs. Persons living with disabilities in most cases have limited access to HIV/AIDS prevention and treatment programs due to several reasons. Sometimes, they lack information about the programs, and other times, the programs are inaccessible to them. 5. Lack of accessibility in condoms and testing kits. Another contributing factor to the spread of HIV/AIDS in persons living with disabilities is the lack of accessibility to condoms and testing kits. For instance, people with mobility or sensory impairments may face a challenge while using the available condoms in the market. The increased spread of HIV/AIDS in persons living with disabilities is a complex issue with many contributing factors as stated above and even more. Increasing awareness and education, improving access to healthcare services geared towards persons living with disability needed. Without addressing these causes, the spread of HIV/AIDS in persons living with disabilities will only continue to rise.